Good afternoon. Thank you for having me, Mr. Henderson. My name is Jennifer Dunn. I'm the Regional Services Administrator for the Region 4 Field Office for the Department of Behavioral Health and Developmental Disabilities. The Region 4 Field Office is in Southwest Georgia, and we cover the 24 counties around Valdosta, Albany, Thomasville, Bainbridge. Thank you for having me.
Tell me, Jennifer, what you're seeing from a clinical perspective relative to the impact of COVID-19 on families and children.
Okay, sure. I am a clinician by trade. I'm a licensed marriage and family therapist, and what I have seen so far is a lot of folks that are feeling really isolated, very depressed. The pandemic has caused people, to shelter in place or to quarantine, and they have some of their social networks that they would previously be engaged with, they've had to find alternative ways to do that. The fortunate thing for us is that we have been able to provide some resources for individuals that might be experiencing some of those symptoms like depression and isolation and anxiety. Anxiety is another big one that we have seen. So we have started an emotional support line. It's a call-in line that you can call from 8 a.m. to 11 p.m. and talk to somebody and get some help and maybe get some resources. That number is 866-399-8938. It's our emotional support line. And let's say, for example, somebody might call that line and may be in a crisis. If they are, we would transfer them over to our Georgia Crisis and Access line. Individuals obviously can call the Georgia Crisis and Access line anytime that they want. That number is 800-715-4225, and it is 24/7. But the emotional support line is dedicated to individuals experiencing those symptoms of anxiety, depression, sadness due to the pandemic. And anybody can call. Healthcare workers, other therapists that are trying to work in this environment, emergency care workers, first responders, anybody.
David, from your perspective, talk to me about how difficult it is, or maybe it's not so difficult, in getting the word out to the people that need these services.
It's always more difficult than it appears, because we are doing our best to get the word out through all of our social media platforms, our newsletters. We even do a daily press clips. We try to get the information included in that. We've also done some public service announcements. And as hard as we try to get the word out, there's always somebody who we go somewhere and they say, I wasn't aware of any of this. So we can't blink on it. We have to be very, very vigilant on always giving the message that Jennifer just gave. These are the resources. And most importantly, here's how you access the resources. Here's the phone number. This is what you need to do. You can also obtain this information on the DBHDD website. In addition, there's one other resource we have. It's a 2x2 series. It's every Tuesday and Thursday. Jennifer has been one of the star presenters where we do self-help topics. So somebody can call in and participate, in a self-help subject, and the feedback we get from those is really very good. So we have to be, like I said, we have to be very vigilant about this. We can't blink. We've got to keep stressing. Here's what the resources are, and here's how to access those resources.
Denese, from a clinical point of view, especially as you move into private practice, how is the isolation, the depression, COVID-19 itself impacting the family unit?
The domestic violence rate is up. We're seeing more and more people feeling trapped, and they're in situations. The substance abuse use is going up because people are sitting at home and they're not knowing what to do with themselves. Tempers are getting a little shorter. People who have anxiety are more and more afraid because some of them, interestingly enough though, are comfortable because they didn't want to go out in the first place. So now everybody else is going to have to stay home just like they do. But for some people, the depression is worse because they're not distracted by the things they were distracted or used as coping skills before. So, and then parents are having to deal with children 24/7, whereas before they might get a break by having the kids go to school or go to camp or go on a play date or something like that. Now they're with them every minute of the day, and sometimes that's very, very taxing, and so tempers are shorter. In some cases, it's actually drawn a family closer together because they're doing more, they're having dinner, they're playing games and things like that. It just kind of depends on who you were before the pandemic started. And it's
We
showing.
hear a lot about families being drawn closer together now. We hear a lot about COVID-19 has given me the time to improve this and improve that. But there's a darker side to that. Jennifer, talk to me about that. And especially as it relates to the anxieties, because we also have a resurgence of opioid use and abuse.
We do. We've seen an increase in people reverting to probably some not great coping mechanisms, things that that might have been productive for them pre-COVID-19. They don't have some of those outlets anymore. I will say that our provider network that contracts with DBHDD has done an excellent job in terms of pivoting and offering telehealth and, groups where they can socially distance and things like that. But you're absolutely right. A lot of people do have anxieties about just how they're going to relate to their families, their coworkers, and then there's a little bit of stigma attached right now with people that have tested positive or might have had to quarantine and that sort of thing. So we're trying to normalize and offer resources to those individuals and make sure that they are aware that they can, that it's okay to ask for help. We do have a couple of events going on right now, particularly related to the opioid epidemic. We have trainings that are available from now until September 18th. We were going to offer them in person, but due to the pandemic, they're now a virtual event, and they are targeted for first responders and faith-based leaders. And so it teaches the administration of naloxone and the Narcan kits so that if somebody does happen to overdose, individuals would have access to those resources as well.
David, how have the budget cuts implemented by the current state government administration affected your ability to program and market?
It really hasn't made that much of a difference in our ability to program and market. We're still able to carry on, and as we're talking about some of the negative effects of COVID-19, that's truly a negative effect of COVID-19, the loss of the tax revenue for the state, which necessitated the budget reduction. But it has not, as far as our ability to get the word out, it has not affected our ability to get the word out or be responsive to media when media, has requests of us, like to do a podcast like we're doing this afternoon or any other article, because we do. There's just a lot of course, there's a lot of interest coming from the media right now on things associated with COVID-19, and particularly in the behavioral health area.
What is it, David, that you would like most for members of the community to do? Those who experience negative causalities and those who are not. What can we do in a team effort to make your job easier? You and Jennifer, as well as Denese.
Well, I think just one basic premise is it's okay not to be okay, but if you're not okay, what we would like you to do is to seek out resources to assist you. And there's nothing wrong with seeking out those resources to assist you. As Jennifer mentioned, one of the main things that we're seeing is high levels of anxiety. So if you are suffering from anxiety, during this time, that's really not all that unusual. So we'd like for you to seek the assistance that you need to assist you with that anxiety, to bring those anxiety levels back down to a normal level.
A lot of
Yeah,
people.
And also, the
Yes, go
other
ahead.
thing I wanted to say, and to remember the concept that, quarantining or being by yourself does not have to equate to social isolation. Social distancing does not have to equate to social isolation.
Jennifer.
Yes, sir. I was going to agree with what David said. He mentioned a while ago that we do a 2x2 series at Tuesdays and Thursdays at 2 o'clock where we offer some tips. I've been a presenter on some of the 2x2s. We started out with the 2x2 series as a request from public health and how to work with frontline healthcare workers that were, experiencing some stress and anxiety themselves. And so one of the things that we've done on the 2x2s, one of the sessions I did was called "It's Okay to Ask for Help," because we want people to know, especially people that have never sought mental health or behavioral health resources in the past. That's one of the things I think we've seen from the pandemic is that a new population of people who've not experienced anxiety or depression or sadness or any of those kinds of things previously, all of a sudden are. And, frankly, I'd be worried if some people weren't, because that's a normal reaction to what's going on. And we just want people to know that there are resources out there and that there is no wrong door. We'll get you to the right level of service that you need.
When you look at what's happening to families, those who are less able to fend for themselves, the children often suffer the brunt of many, many causal factors that can be negative. What do you do in instances like that?
I'm going to answer that if you want. Legacy Behavioral Health here in Lowndes County and a number of the DBHDD places, one of the things I want people to remember is that you don't have to have insurance to come to those places. A lot of people won't come because they think they need insurances, but we also have we work with children and we work with what's going on with them. And as we work with them, if we discover that there's something going on more, then we do the appropriate steps and try to discover how serious it really is, and then do what is, we're mandated reporters. So if we have to report any kind of abuse, we will do that. But if the child is experiencing anxiety or the mother's feeling overwhelmed, we will work with the family.
In the news this morning, there was a story about LARC, the agency that helps parents and caregivers deal with children and adults who have developmental disabilities. Their budget was cut by 60%. Now they have reopened, but they are still asking the community to come to their aid and assistance. What kind of pressure does that put on a family? Because the LARC agency, when it shut down, caused parents to have to, on a full-time basis, take care of those persons with disabilities, one kind or another, at home all the time, which means that they could not work. Are you running into situations like that?
I'm not, I can't directly speak to the situation at LARC, just because I don't have that knowledge. But we are running into some situations just because of, not just because of the budget reduction that occurred, but because of COVID and having closed some of the facilities down and people not being able to go to those facilities like they normally go, which does put a burden on the family, because now the family is having to care for the individuals instead of being able to do other things such as work. So yes, that there is a concern about that.
Jennifer, are
But
you
as
seeing?
we,
Yes, sir.
I was just going to say, as we hear about those individual cases, we do try to assist with those cases to see what are there any alternatives that we can offer.
From the clinical point of view, are you seeing a variation on that theme from women to men or men to women?
Well, I mean, obviously, men and women show their emotions, they show their stressors in different ways. And so if a man is the breadwinner of a family and due to the pandemic might lose his job, that might look a lot different than if it's the female in the house, or, you know, maybe the roles are reversed. Maybe the female is the breadwinner. And I think it really is a individual type of assessment that we would do to determine what's going on with each person and what kind of resources do they need. But I do agree with what David just said. You know, we try to assess individually, whether it's the family unit or the child or, you know, the individual themselves, what resources we can help them with. And as Denese so eloquently put it earlier, all of our community service boards, their primary function is to serve those that are indigent, that don't have the resources. And so that's why we fund them, we as in DBHDD. And so we don't want that to be a barrier.
I need help. My marriage is failing because of COVID-19, and COVID-19 gets a lot of blame for a lot of things that I'm sure it might exacerbate.
We know that's not true.
Right, it's not necessarily the primal factor, but my marriage is failing, my job is going down the tubes, or I've already been laid off, or my business is closed down, or the business owner had to shut down and send everybody home. The kids are up under me all day, all night. What do I do? Talk to me about resources.
Yeah, so we have lots of resources available. Some we've mentioned, and I'll just mention them again. We've got our Georgia Crisis and Access Line, which is a phone number if somebody feels like they're in crisis. So that stress that you just described, let's say it's very intense. That might be a person that would call the Georgia Crisis and Access Line. Let's say you're a kid and you don't like to talk on the phone, you'd rather text, because I have 2 kids and they would prefer to text me than to talk to me sometimes. So you can go to the App Store, the Play Store, whether you have an Android phone or an iPhone, and download the GCal app. It's called My GCal, and it's a green app. And they can text to chat what's going on with them. That resource is also available for individuals that are hard of hearing, maybe those that speak American Sign Language. And so we want to make sure people know that that's out there. Again, if you just want to call and talk to somebody about, hey, this is what I'm feeling, my as you just described, I lost my job, my marriage is on the rocks, my kids are driving me crazy, you know, you can call the COVID Emotional Support Line. And again, that number is 866-399-8938. And we're going to manage to link you to some resources. I've taken several shifts on that line as a therapist, and I would, you know, help somebody from anything from, hey, I need food, I need to know where my local food bank is, to you know, I had one lady that called in that really needed some help. She was scared to go back to her job. She had never sought psychiatric care in the past and was having panic attacks. And we did some deep breathing, and I was able to give her some videos to watch. Some we did together on the phone that day, and some that she could watch later. And, you know, just because somebody calls that line one time doesn't mean that they can't call it again. You can call as many times as you'd like. If it's somebody that's just calling to talk, we might transition them over to another line that is more adapted, just, you know, talking to folks about that just want to chat, you know, that sort of thing. The 2x2s are available Tuesdays and Thursdays for anybody that wants to listen to those. And those are fun. Those can be anything from a very intense subject like racial disparities and how do you talk to your children about that and what's going on in the world, to how to make a TikTok video with your kids and make it fun, or how to, there was one about cooking and one about dancing. And but they're all things that you can do to kind of either connect with people or take your mind off what's going on, just a reset button, if you will. And they're recorded too. So let's say you've missed the ones that we've done. We started them in May. I've got a link that I'm going to send you that you can share with your audiences so that people can go back and read through them. There was one yesterday, and it was about how to make a man cave. And I don't know, I can't remember the name of it, but it was a gentleman that did it, and I thought it was super cute. And so, again, each Tuesday and Thursday, you're going to get a different theme, and there's pretty much anything you could think about. Journaling, apps that are great right now for people to download, especially for kids that need to practice deep breathing and all kinds of good stuff. So those are just a few things. Obviously, we encourage people to seek out their local community service board. And if you're in the Valdosta area or any of the 10 counties around there, that would be Legacy Behavioral Healthcare Services.
Let me ask you, have you found in your work ethnic differences that create different kinds of problems? Or is everybody's problem everybody's problem? Is it the same?
I'm going to answer that because one of the things that we do as therapists regularly every year is we have to take a cultural sensitivity course, because different ethnic groups sometimes have different issues. Their feelings of how the world is going are different. Not just black and white, but actually religious cultures. Here in Valdosta, we still have students who are trying to adjust to different things. We have gender differences. We have people who have different kinds of issues. Sometimes with everything that's going on in the world, I had a gentleman the other day who I talked to who said that he felt like he was going crazy because he just hates everything that's happening in the world, and he feels people are being so mean. And he is a client who started out as a severely mentally ill person who has now transitioned to much more stability. So my job with him yesterday was to make sure he didn't go back into crisis, because he was feeling very, very, very overwhelmed by what he was seeing. So yes, it does affect people in terms of how they see the culture and the world and how they grow up.
How important are community partnerships in the work that all three of you do?
I would say they're critical. I don't think we could do the work without community partnerships. I spend a lot of time on the phone with local sheriff's departments and police departments. I also talk to a lot of, homeless shelters. I talk to just all kinds of resources from, people that work in probation parole, which is through the Department of Corrections, also Department of Education, because a lot of our providers work with kids in the school system, and with schools starting back, and it's already started back in some places, and other places it's starting next week. We're going to see an increase in those communications and relationships, but we cannot be successful and do what we do without having good partners and good relationships with those partners. Our local emergency rooms, so that when people do end up in crisis, we spend a lot of time talking to the administrators and some of the doctors in the local emergency rooms so that we can get them to the right level of care. So I think it's critical.
You talked about...
And
yes,
I was just going to say, I wholeheartedly agree with Jennifer. When you're working with people, and particularly people who have are being served by us, their issues just cross-cut so many different social agencies in any community, and you have to work with all those agencies. The court, Jennifer named a whole bunch, and in addition, there's the court, the probate courts, the superior courts, Department of Community Supervision. The list just goes on and on and on. And you have to be working together or hand in glove with all those agencies to be successful.
We have been talking with Dr. Joe Troop, Pastor Joe Troop, here in our area about the community resources, about the resources that Jennifer has informed us about And we are trying to, in the faith-based community, get more actively involved in telling people about these resources and encouraging them, exhorting them, go and get the help you need. We find that there is a shame-based factor involved in this. And I'm so glad, Jennifer, that you said a lot of people who never thought that they would get help or need help are now reaching out for help. Talk to me about the shame factor.
Well, it depends on, there's a lot of stigma right now. There always has been. I think it has reduced. That's why I do think we have more people that are willing to talk, just like we're having this conversation right now. I think having conversations like this, we have an event coming up with a couple of local radio stations on September the 10th and the 17th to talk about resources. Those are going to be held in the Albany area with station 104.5, which is a country station, and then 101.7, which is Albany's R&B leader. I think having conversations with you, with those stations, to say, everybody experiences stress and anxiety in different ways. How it manifests with one person is different from somebody else. And it's okay to ask for help. We also offer a lot of mental health first aid classes. And I think in offering the mental health first aid classes, those are available to anybody. Right before the pandemic started, I had personally offered some. I teach those classes, and everybody from 911 operators to pastors to county extension agents in the rural areas who work on farms, anybody can take those classes. It's a one-day class, and one of the things it does is it teaches you that you don't have to be a therapist like Denese and I. You could be a good friend, a good neighbor, a good family member, and connect somebody to resources, but you need to know where those resources are. And so that's one of the things why we offer those classes. So, I do think stigma is still around, and I hate that, but we're doing everything we can to bust through it and to let people know that you don't have to be ashamed to ask for help, and that help is available.
Talk to me about
the other thing.
Yes,
if I can just add one
please.
more thing. The other thing that's very refreshing is the younger generation. There does not seem to be the same level of stigma that I grew up with. They don't hesitate to talk about having needs and seeking help. And the other thing that Jennifer mentioned is our young performers who are speaking out about mental health issues and having anxiety and getting assistance. That's really refreshing. And I think as a result of it, it's going to keep reducing the stigma.
What is included in your mental health first aid kit?
Well, it's an 8-hour class, and what you do at the end of it, and I wish I had one of the notebooks with me, but you get to take a notebook home. You're going to have a notebook that's going to have all kinds of, factual information, some statistics. You're going to do some exercises that are going to teach you how common some things are and how uncommon some things are. Because there's some things that, based on watching, local TV and things like that you might think, I'll just give you an example. People who have a diagnosis of schizophrenia, one of the things we do in the class is we say, how many people do you think in, the general population have that diagnosis? And people throw out very large numbers because it tends to get sensationalized on, certain things when it's a very, very low number. It's less than 1%. And so in some areas, and maybe up to 3% in others. So you're going to walk away from that class with not only some actual factual information, you're going to have local resources. So if you take the class in Tipton, you're going to get resources that are about the Tipton area and where to get, information to link people up. Maybe it's your local NAMI group. Maybe you want to, NAMI stands for the National Alliance of Mental Illness. And so it could be something like that. It could be one of our addiction recovery support centers. And those are places where people can just walk in that might have an addiction and they want to talk about what's going on with them. The individuals there that help the people walking in are people who are in recovery themselves, so they can speak to that in a different way than somebody who has not walked in their shoes. And so you get resources, you get the notebook, and you get contacts. So the one of the best things I've gotten feedback on from the class is I know now who to call when I need help with something. And I'll just give you an example. I get a text message on my phone earlier today from somebody who was in one of my mental health first aid classes, and they were looking for help for a family friend. And, you know, I was able to connect them with some services.
Tell me about the coverage area that you serve. It's not nearly as localized as we tend to think that it is. It is a wide area of service provision. Talk to me about that.
Well, my office covers the 24 counties of Southwest Georgia. Is that what you're asking about?
Yes,
the number
exactly.
of counties? Yeah, so there's 10 counties around Valdosta that we cover. There is 8 counties around Albany and 6 around Thomasville. And so it basically goes up I-75 to Turner County, over around Worth County, all the way to, say, Terrell and Lee County, and then back down. And so 24 counties is a lot, but I feel very connected to those counties. I'm from this area. I grew up in the Albany-Lee County area. I went to high school there. My dad lives in the Arlington-Blakely area, so I feel real connected to the 24 counties that I serve.
David, what can the faith-based community do to help you in terms of getting more of the word out about service provision and helping those people that really need help, people like myself?
Well, I think you can definitely help us by getting the word out about all the resources Jennifer has mentioned. And if you want, I know Jennifer will send you material that you can have available for pastors. We can also send you, if you'd like, we have what we call our Georgia Crisis and Access Line cards that you can give out to pastors, and pastors can give out to those cards to their parishioners, or have them available at a table in the back of the church. So if somebody's walking by, they could pick one up and take it with them. So we can provide you with some actual hands-on physical resources that you can have. And then I'd also like you to just remind pastors that because of COVID-19 and everybody being, basically quarantining or social isolating, our numbers of bad things happening to people, like child abuse calls, are significantly decreased. Now, we'll probably see those come up again once everybody gets back in school. Some schools have started. I know over here in, even though I have a statewide purview, which is a little bit different than Jennifer, I also reside in Thomasville, and I know our schools over here in Thomasville are going to start up again, at least our public schools start up again on Tuesday. So we'll probably see reports of child abuse start to go on an ascending trend. And then also be on the lookout for signs of domestic violence. That's another area that is not being reported as much anymore. So if you could just speak to the pastors about those kinds of things, be on the lookout. And then we can get, like I said, we can get you some physical resources that you can give to the faith community.
The kids and the grandkids are about to go to school next week.
Yes. Yes.
He's dancing.
Makes me real happy, and I'm excited for them. What should parents, grandparents, guardians be on the lookout for as these children make their way back to school next week on a full-time basis? Some virtual,
Well,
some in class, some are going to be doing both. What should we be looking for?
well, you want to make sure, I attend a lot of meetings with our public health partners, and they call it the 3 W's. So it's wear a mask, wash your hands, and watch your distance. So if they're going to be in person, you want to remind kids, and it's easy for kids to remember something like the 3 W's, right? So you want to remind them of those things. If they're doing a lot more virtual things, you want to, as a parent, I have a child that will be starting school next week. He'll be a sophomore, and I can say that when we ended the school year last year, the school provided excellent resources. I don't know that my child took advantage of all of the resources, that that would have been beneficial. So I know I have to practice myself as a parent to make sure I'm on top of, is he turning in his assignments if he's doing virtual classes. So, but from a mental health perspective, if they are, doing virtual classes, making sure that they are connecting with their friends on Zoom or FaceTiming, family members or friends, their social networks are very important to young kids and teenagers. And the more we can create opportunities for that, I think the better adjusted they're going to feel. But we should watch out for, like David mentioned, if kids are staying home and teachers who are number one reporter are not able to see some signs of neglect or abuse, we need to ask, parents to just communicate with their children. Because a lot of times kids will tell their friends stuff that they're not going to tell their parents. And so as good citizens, I think we need to have very open relationships and communication with our children to find out how they are doing and how their peer group is doing, because a lot of times how their peer group is doing is influences how they might describe how they're doing.
I think we also have to make sure that we're talking to our children about their day, and because it's going to be different at school. So we need to see if they're experiencing any anxiety about the fact that now they're in their classroom the whole day, except for maybe going to some elective, or they do get a recess, but recess will be very different. And just kind of keep an eye on what they're feeling. And again, just like with mental health, not being afraid to ask for help. Those parents who are doing virtual and trying to work and maybe feeling overwhelmed from a mental health standpoint need to know that this might get frustrating for them. They might feel overwhelmed, and they can reach out and help and ask for help.
Where do we go looking at the daily increase in the number of infections and the number of deaths if the coronavirus is still around come December 31st, going into a new year? What would you have the community to do to help you in getting people the help they need? Because if the situation is tense now, if the situation is overwhelming now, we've got Halloween, we've got Thanksgiving, we've got Christmas, we've got holidays coming up, holidays that are going to affect a diverse group of people in many different ways. What do we do?
Wow, that's not an easy question, and I don't think there'll be an easy answer for that. It's very complicated. So I'll just let you know, my son went off to college this year, and for the first time, he's a freshman. His senior year was very different because of COVID, and his, beginning of his freshman year at college was very different. And he's somebody that is a rule follower. He wore his mask and did everything, and he was sent home a week and a half ago, and he tested positive for COVID. And so I have been talking with him. He will be going back to school after his 14 days of quarantine are over. And luckily, he's somebody that had very mild symptoms. He did run fever and did describe some of the things that other people talk about. But, he's a very healthy, young, 18-year-old. And his biggest fear is, I really want to see my grandmother, or I really want to see my granddad, but I'm scared, even after the 14 days is over, that I want to see them and I'm going to compromise their health in some way. And so I think as a community, we have to figure out ways that we can be creative with how to include family time. And as you talked just now about holidays that are coming up, that's going to be different if this virus is still around. And I think that it will be. I don't think it'll be a miraculous thing where it goes away. And so one of the things that I think we can do is manage people's expectations, especially young children. and start talking, like Denise mentioned earlier, have conversations, ask them how their day went, you know, talk to them about what is going on. I don't know, I think this is a very complicated situation, and it's going to take a lot of very smart people getting together to figure out how we can socially distance together. So we might not be in the same physical space, but that doesn't mean that we're apart, that we're still together.
Football season is here. Games start tonight. You will have to social distance as you stand in line to enter the stadium. You have to wear a mask, but the stadium will be wide open. You can sit where you want to sit, next to whom you'd like to sit next to. What in the world are we going to do?
That's an excellent question. The one thing I was going to add is we're also hearing that the vaccine may or may not be available in October. I mean, some say as early as October 1st. Others say there's no, that's not really very realistic. But even if let's say the best case scenario, and it is available October 1st, it's going to be a while before everybody who wants to have the vaccination can get the vaccination. So, I mean, COVID's going to be around. It's going to be around for a while, and we're going to have to do some of the things that Jennifer was talking about earlier, as far as, you know, how we behave and not letting our guard down. It's definitely, like our commissioner likes to say, it's customized coexistence with COVID-19.
I like that. I like that. Jennifer, if you would be so kind, give us that number that people can call again. We know about services here in Valdosta, but people are very mobile now. And I might need to come to Thomasville for some help. Or I might need to pick up the phone and call David one day and say, help me. What do we do? What's that number?
Yes, so we have two numbers that I'd like to share with you again. The first is our Georgia Crisis and Access Line, and anybody can call that number 24/7, 365. The person that answers the phone is a licensed clinician, and that number is 1-800-715-4225. And I'll be happy to give you some cards so that you can pass them out to your congregations or give, to anybody, your neighbors and your friends. You can also download the MyGCal app on the Play Store or the iTunes Store. It's a little green icon. It says MyGCal, and you can text. So a lot of kids prefer to do that. So feel free to download that app and text the crisis line. The other number is our DVHDD emotional support line, and that number is for anybody to call. It is open from 8 a.m. to 11 p.m. It is 866-399-8938. And that is for people that might want to talk about some stressors that they're experiencing related to the pandemic. And if, for example, they call and they don't want to talk about COVID or the pandemic, that's fine too. We have lots of places that we can refer you. You can call that number and say, I want to go see a therapist, but I'm moving to Columbus. Who can I call in Columbus? We're going to be able to give you a resource for Columbus, or maybe you're going to Savannah, or maybe you're going to Helen, Georgia. Wherever it is in the state of Georgia, we're going to be able to connect you to some resources locally and some phone numbers like the ones I've mentioned here.
One last thing I want to touch upon. The University System of Georgia, 3,000 positive cases of the coronavirus across the state in public colleges and universities. Administrators are encouraging dormitory students to get out of the roommate situation, opting for single room occupancy. That's got to have an effect on a kid who's, I'm away from home, I'm away from mom and dad, I've got my own place to live, and I've got a roommate and we get along just fine. Now, all of a sudden, there is a threat to that relationship, and now you tell me either they got to move out of the dorm or out of the room, or I have to move out of the room so that I don't get infected or so that I don't affect and infect them. What do we say?
Well, I mean, not all colleges and universities in the state in our system can do that. I know that the college my son goes to, that they don't have enough space to do that. Some are trying to create those spaces, and I've read some articles about some colleges that have rented, you know, hotels to allow for some of this kind of thing. But I think that, you know, it's real important because you know, what happens when kids go off to college, and I can speak now since I'm having that experience, is the school doesn't talk to the parents very much because your child is 18 and they're considered an adult. And so I may be paying for tuition, but all the communication is going to my child. And so again, like Denise referenced earlier, we have to be able to communicate with our children, and they have to communicate with us on what their needs are and how we can work with whatever university or college or technical school they may be going to. I have found in talking to friends who have kids at all different colleges across the state of Georgia that, you know, every college is doing this a little bit differently in how they're communicating. So my son is going to Georgia College and State University in Milledgeville. David has had a couple of his kids there. I know that I went to the University of Georgia, and I've got several friends with kids at UGA, and they're doing things, very creative things, like anybody that gets diagnosed with COVID, they're assigning them a case manager, for lack of a better word, somebody that they can communicate with about what the rules are, about when they come back, how do they, you know, especially for a first-time kid. So a first-time kid's going to college and then they get sent home. How do I keep up with my classes? What if it's a class that's not virtual? Is this professor going to let me get the notes from somebody because it was mandatory that I go home and quarantine? You know, so this case manager is going to link them up with the right resources. I don't think they call it a case manager, but that's what it sounded like to me. So that's what I'm calling it. But I think that I've been impressed with our educational system, the university system of Georgia, and their ability to be open to hearing feedback from parents and from the kids. Because a lot of kids, even kids that have tested positive, they don't want to go home. They want to stay where they've made some new friends. And they, you know, they might have to be in their dorm room for a little while and isolate for 10 to 14 days, but they don't want to, you know, this is a kind of rite of passage for a lot of people, and they don't want to miss out on some of that stuff. So again, it's all about those connections, those relationships that you have, and the communication.
Jennifer, I want to thank you for the information that you sent to us. David Sofferin, Jennifer Dunn, Denese Henderson, I thank you for sharing with us today.
Thank you for
having us.
Yeah, thank you so much.